Veterans, what happens when the VA tells you no? At 100% disabled, you'd think they'd cover everything. They don't. And if you skipped Medicare Part B, waiting for that day, you have no backup, no options, just penalties. What I'm about to show you will either save you thousands or cost you thousands. My 82-year-old dad found out the hard way, but he was ready. I'm going to show you exactly how. Hit subscribe, save this for later, and share it with another veteran. What I'm about to show you comes straight from VA.gov. Not my opinion, not something I overheard, having a couple of highballs at the VFW, the VA's own words on their own website. And there's a page in Medicare's own handbook that changes everything. I'm Chris Duncan. I wrote Medicare for Veterans, the Complete Field Guide. You can read it for free at freevetsbook.com or grab a copy on Amazon. I've been helping people with Medicare for nearly 20 years. My team and I focus on helping veterans understand how their benefits actually work, make sure they're not overpaying for Medicare Part B, and help them access benefits the VA, Original Medicare, and TRICARE for Life don't provide. And Medicare rules make it so all of our services are at no cost to you. Now let me show you what the VA says about Medicare and why they say it. Here's the conversation my team has on a daily basis with veterans. Jeff, my best friend for over 30 years and one of our veteran Medicare specialists, picks up the phone, a veteran on the other end, 100% disabled, full VA health care, and he's frustrated. Why would I pay $202.90 a month for Medicare when the VA already covers me? That's throwing money away. And I understand why he thinks that. It's logical. If you have coverage, why pay for more coverage? But here's what he doesn't understand. You remember the FICA box on your pay stubs? That wasn't a suggestion. That was Medicare taking its cut for 40 years. A veteran who earned $50,000 a year on average, he paid roughly $58,000 into Medicare over his working life. Made more than that? You paid more than that. That money is already gone. The question is whether you're going to use what you paid for. And here is what nobody else told him. Here's the 2026 Medicare and You Handbook, page 11. You can get a free digital copy at Medicare.gov. Let me read this to you. You pay the monthly Part B premium and may also have to pay the plan's premium. Some plans may have a $0 premium and may help pay all or part of your Part B premium. Some plans may help pay all or part of your Part B premium. That's not me talking. That's Medicare's own handbook. Nobody told him that. Nobody told him some veterans are getting extra benefits. The VA, Original Medicare, and TRICARE for Life don't provide. When veterans read this quote from VA.gov, their whole view changes. On VA.gov, there's a page specifically about Medicare and VA health benefits. Here's what it says. I'm quoting directly. We recommend that you enroll in Medicare. I'll read that again. The VA recommends that you enroll in Medicare, not consider it, not some veterans might want to look into it. They recommend it. Now think about that for a second. The VA provides your health care, and they're telling you to get Medicare. Why would they do that? Same page answers the question, and this is the part that should concern every veteran. The VA website says this, direct quote, VA healthcare funding could change in the future. Read that carefully. The VA is telling you in writing on their own website that their funding is not guaranteed. They're not predicting it will change. They're acknowledging it could. Political priorities shift, budgets get cut, programs get restructured, administrations change. The VA knows this better than anyone. They've seen it happen. That's why they tell you to have Medicare, not as a replacement, but as a backup and as a way to access strategies that can help make sure you're not overpaying. I made a video specifically about what happens to your VA benefits during government shutdowns and budget fights. It's popping up on your screen right now, but funding isn't the only reason. There's something more immediate, something my own dad experienced this year. Even with a 100% disability rating, the VA can say no. You need a specialist outside the VA system with community care, they have to pre-authorize it, and they can deny you. You're traveling and need emergency care, the VA has rules about what they'll cover away from home. And those rules have limits. I break down exactly what that can cost in another video. Why VA won't tell veterans about $15,000 ER bills. It's on your screen now. You want a second opinion from a doctor who isn't in the VA network? You're probably paying out of pocket. Now, let me be clear. This isn't VA bashing. My dad and I are very happy with the care he gets through the VA. But like my dad says, Chris, the VA is great, but it ain't perfect. He would know because earlier this year, the VA told him no. My dad, Wallace, is 82 years old, Vietnam-era veteran. Earlier this year, he was at the VA. He needed a specific treatment. The VA looked at it and said, no, not medically necessary in their eyes. Now, my dad is 82. He could have panicked. He could have stressed himself out fighting the system. Instead, he called me. He said, Chris, they won't cover it. I said, Dad, don't panic. That's why you have a Medicare Advantage Part C plan. Call your doctor and go that route. A week later, he had an appointment with his primary care doctor. Shortly after that, he was getting the treatment he needed. The VA said it wasn't medically necessary. His Medicare Advantage plan covered it. Could we have appealed the VA decision? Sure. Filed paperwork, waited months, maybe won, maybe lost. But my dad is 82. At that age, you stay away from stress whenever you can. Medicare gave him another option, a faster path, a less stressful path. And here's what else. My dad isn't overpaying for Part B. Remember page 11 on the 2026 Medicare and You handbook? Some options may have a $0 premium and may help pay all or part of your Part B premium. My dad's plan happens to be one of those. The way his coverage is structured, he's paying less out of pocket for his Medicare overall, and he's getting extra benefits the VA doesn't provide. That's why he has both, and that's one of the reasons why the VA recommends you have both as well. But here's where veterans get trapped. They wait too long to figure this out. VA healthcare is not creditable coverage for Medicare Part B. That's not my rule. That's federal law. If you delay enrolling in Part B because you thought the VA was enough, Medicare charges you a penalty, 10% added to your premium for every 12 months you waited. Skip Part B for 3 years, 30% penalty. Your $202.90 becomes $263.77. Skipped for 5 years, 50% penalty. Now you're paying over $300 a month. And here's the part that makes it cruel. That penalty is permanent. It never goes away. And because it's a percentage, it grows every time the Part B premium increases. I break down exactly what that costs year by year in another video. Veterans don't know they lose $2,472 to Medicare in 2026. It's on your screen right now. The veteran who skipped Medicare to save money ends up paying more than everyone else forever. My friend Rick is a 100% disabled Vietnam veteran. I've known him for over 20 years, full VA healthcare, full VA disability compensation, and he has Medicare. He's enrolled in one of the Medicare health plan options available in his county. His plan provides extra benefits the VA and original Medicare don't provide. And here's the part that matters most. If the VA ever tells Rick no, If they ever say a treatment isn't medically necessary, if they ever make him wait longer than he thinks he should, he has options. Same as my dad. Same phone call, same path out. That's not a backup plan collecting dust. That's peace of mind for a man who already gave enough. Now, let me show you 3 veterans, all 100% disabled, same rating, very different outcomes. Veteran A believed the myth. The VA covers everything. Skipped Part B. When the VA finally told him no, he had no backup. And now he's paying penalties forever. Veteran B, he waited. He figured he'd deal with Medicare later. Later came with a 30% penalty. He's paying more than he should every month for the rest of his life. Now Veteran C is Rick. He understood what the VA actually recommends. He enrolled during his initial enrollment window, no penalties. He explored strategies to make sure he's not overpaying for Medicare Part B. He's getting extra benefits the VA doesn't provide, and he has choices outside the VA system if he's getting the treatment he deserves. Same disability rating, 3 completely different outcomes. Which veteran are you going to be? Here's what you need to do. First, if you're approaching 65, you have a 7-month window around your birthday to enroll in Medicare Part B without penalties. 3 months before your birthday month, and 3 months after. Miss that window and the penalty clock starts. Second, go to VA.gov yourself. Search Medicare and VA health benefits. Read what they actually recommend. See it with your own eyes. Third, understand that Medicare and VA benefits complement each other. Getting Medicare doesn't change your VA care. You keep everything you have. You're adding options, protection, and access to strategies that make sure you're not overpaying for the Part B premium. You have already earned benefits that you funded through FICA. Don't waste that money. Benefits and costs vary by county and plan. Not every veteran will have the same options available, but you can't explore those options if you never enrolled. If you want to learn more about how Medicare works with VA benefits, I wrote the book on it, literally. Medicare for Veterans, the Complete Field Guide. You can read it for free at freevetsbook.com or grab a copy on Amazon. If you like the way I explain this and want to learn more about my background, simply search Chris Duncan, We Speak Veteran. I'm not affiliated with or endorsed by Social Security, Medicare, the VA, TRICARE, or any government agency, nor would I want to be. This video is educational. It's not a recommendation for any specific plan. Benefits and costs vary by county and plan. Not every veteran will have the same options available. I'm Chris Duncan, and We Speak Veteran. If this helped you understand why 100% disabled veterans still need Medicare, hit that like button and subscribe to the channel. Share this with a fellow veteran who's been told they don't need it. They need to hear this. You're seeing 2 videos on your screen right now. On one side, why VA won't tell veterans about $15,000 ER bills. Shows you what happens when the VA doesn't cover emergency care away from home. On the other side, what VA won't tell veterans about what survives shutdowns. Explains why the VA itself tells you to have Medicare as a backup. Pick the one that answers your next question, and I'll see you there.